With the country in the grip of a wave of superflu, demand for the vaccine at this pharmacy in West London is so high, it's run out of stock.
Mainly the elderly and vulnerable, they do seem quite worried when they come in. And if I don't have stock, they get extra worried. They're like, oh no pharmacy has it. When can I get it done? There's been a really high demand for it. I've been short every week. I've had to turn away many patients. Many patients leave angry, frustrated.
The new H3N2 strain is highly infectious and hospitalising people in record numbers. Today marks a really important day in the battle against this wave of superflu. For a vaccine to give you maximum protection, it takes about 2 weeks to build up peak immunity. So today is one of the last days to get vaccinated if you want full protection over the Christmas holidays. And it's also today that the BMA resident doctors' ballot opens. The Health Secretary warns if next week's doctor strikes are not called off, and with flu season yet to peak, the combined pressure could topple the NHS.
The real risk for the NHS is that the enormous levels of flu we're seeing, unprecedented at this time of year, particularly nasty strain of flu, combines with strike action to overwhelm the NHS. That's a real risk of harm to patients. It puts intolerable pressure on other NHS staff who will be required to cover strikes and cancel their leave. And it's also entirely unnecessary and avoidable.
The BMA says it's the Health Secretary who's to blame for rejecting their repeated calls for negotiations. If you look at the timeline, you reject what the Health Secretary has said about your action coinciding with this wave of superflu toppling the NHS. He says that's down to you. Do you accept that?
Absolutely not. We've been asking the Health Secretary for months now to come round the table, but sadly, every single time we ask, it takes the announcement of strike action to get him to the table to even negotiate. I see the NHS under pressure every single day that I go to work. I see the NHS under pressure in the summer, and I also see the NHS under pressure into winter. There is still time to avert this strike action.
The pharmacy is expecting new flu jabs any time now, and the hope here and across the country is that demand continues to be high until the wave has passed. Ashish Joshi, Sky News.